Dr. T, let's talk specifically about Botox and improvements which might have been made, but more likely there's that stigma out there that you get a frozen face. You get you see the guys in a movie and they have Botox and then they can't drink their coffee, they slurp all over the place. I'm sure that's a little bit exaggerated even in the old days, but whenever people make a joke about something, there's always a little bit of truth to it, I have noticed. So shed some light on us. Tell us really, give us the lowdown on that stuff. Am I going to look artificial when I do Botox, or is that a myth? Is that something which was but isn't anymore?
Well, not unless you twist my arm. What I mean by that is most clients that come to see me that want Botox or ask for Botox, and again, every patient, every client is unique. I study their face, I study their expressions, and then I show them a mirror and I ask them to tell me what they're asking to improve. Botox or neuroblockers such as Dysport basically has been FDA approved for one wrinkle. It's called the frown line, which is the line between our eyebrows, also known as the glabella complex. My goal, and I encourage, so they're much softer. I do have an occasional client that wants no motion, and I warn them, if there's going to be no motion, your face will look frozen. Most clients, when I share with them that, will choose to go the milder route, which is to soften and not to freeze.
I see. So basically it depends on how much you apply, you freeze up, or you just ease in the wrinkle type of thing.
Exactly. And since in my practice, my clients pay by the unit, it's definitely more economical to get a softening instead of a total paralysis. I would like to mention one thing because many people do not realize this. Botox or Dysport has been FDA approved for one wrinkle and one wrinkle alone, the glabella complex or the frown line. Now we use Botox in what we call an off-label manner for other wrinkles. We can use it for crow's feet. We can actually use it to create a brow lift. And I can't tell you how many of my female patients, particularly when I show them we can do a little bit of brow elevation with Botox, they just love it. It's something I often recommend. Other areas we can use forehead lines in the forehead. We can soften those lines. We can actually even help the corners of the mouth that tend to droop down as we get older. And there are other areas we can use Botox.
I see. Okay. Is it you mentioned in another video that there's also this thing called fillers, which is a little bit a different thing than a Botox. Is it possible or common to use Botox and fillers together, like a little bit of filler here and a little bit of Botox there, and then we'll look good again?
Absolutely. That is absolutely true. In fact, often when my clients complain of a particular wrinkle here, it's been there so long, so many years, what we often do, I should say, is we'll go Botox first, and then we wait a period of time and to see what's left. In many cases, the little crease that's here, because there's no longer that wrinkling, will soften and they no longer have a concern. I do have an occasional client that still has a bit of a crease there because that's been going on for so long, and at that point we can actually add some filler perhaps a month later in order to lessen that depression even more.
All right. Well, here you have it. So basically Botox is kind of only approved for this here, but that doesn't mean it can't be used for other things, and quite often you guys do use it. And this frozen up face, if you do it correctly, you basically know how much you use when it will freeze up, and you can tell the patient, the client beforehand and warn him from it, because, I don't know, it just couldn't outweigh being frozen, having a frozen face, couldn't outweigh the not having a wrinkle anymore.
Yeah, and I really encourage clients, especially first-time clients who have never had any kind of neuroblocker at all, to go conservative. Let's soften. I'll see you in 2 weeks. The follow-up visit 2 weeks later is totally complimentary. There's no charge for the visit unless they choose to want more relaxation. And I do have an occasional patient, perhaps 10% of the time, that says, I love the look, Dr. T, but you know what? I want a little more relaxation. There's just a little too much movement. And then we increase. We give her an additional dose. She only pays for that additional extra Botox or Dysport that she uses then. And often at that time they may choose, especially for the first timers, they will have one area treated on their first visit, and after that they're so pleased that on their second visit they say, this is great, I love the look, now I want to soften my crow's feet, I want to soften my forehead lines, and they will get additional areas treated the second time after they've been, so to speak, broken in to how effective and how harmless Botox can be.
And again, you did mention in another video that on an average it lasts 3 to 4 months, and it can sometimes last a little longer, and apparently could possibly last longer as more often as you do it. Did I get that right? For first timers, it usually lasts about 3 months. What I found, when a client gets a neuroblocker on a regular basis, like every time the muscle starts to get active again, she gets another treatment, that we can extend that to 4, 5, and even 6 months. I have many clients that have been getting a neuroblocker on a regular basis who only now come twice a year. Okay. And definitely no funny major side effects such as, getting dizzy, being drowsy. And I'm talking about long term. I'm not talking right after the operation, maybe for a half an hour a day because of whatever. No getting impotent. None of that stuff happening.
No long-term negative side effects have been reported.
Beautiful. Thanks a lot, Dr. T.
My pleasure.